Good day, professors. I am Owen Mark S. Calamayan, student nursing of Mary Chiles College, section BSN 1C, and today I'm going to perform an assessment of the hair, the neck and skin, eyes and ears, and neck assessment. So let's go. So the first thing to do is to greet our client and identify our client using two identifiers, which is to check the ID band and ask the client itself of his or her name and birthday. Like so. Ma'am, good morning. I am Owen Mark S. Calamayan, BSN 1C of RetDem College, nursing student, and I'll be your nurse assistant or nurse for today. Ma'am, tanong ko lang po yung ating name and birthday. For clarification dito.
Kayla tayo yun po, tapos yung birthday po, October 23, 2018.
Thank you po, ma'am. And I should also explain to my client right here the procedures that I'm going to do, what am I going to do, and why do I need to do it, and how can she participate during the procedure. So, ma'am, ang purpose po ng pag-assess natin ng skin and head, neck po ay to ma-assess po natin yung problems natin about that, and para ma-predict po natin kung may nag-arouse po ng problem, at sa gayon po ay maagapan po natin at makagawa tayong plano kaagad para ma-solution po yun, no? Lamang po, ma'am. And of course, I should also discuss that the results of the assessments will be used to create a future plan of care. So, the next thing to do is to inquire our patient. Ma'am, may tatanong lang po ako na mga, of course, mga katanungan po about the assessment. Okay po. Ito na po natin, ano? I should now assemble the equipment, which I already did, and I should also make the client aware that I'm ready to start the physical assessment. Ma'am, can you start the physical assessment po, no? Thank you po. And I should perform hand hygiene, and I should also observe the appropriate infection control, and I should put on PPE if it is required. Now I'm going to do hand hygiene by using this. And the gloves next. Now that I am done putting on my gloves and my mask, I should provide my client privacy by drawing the curtains and closing the doors. And I should drape my client, which I already did. And I should position my client appropriately by sitting down or lying down, unless the position or otherwise the position is contraindicated. Okay, so let's move on to the assessment of the skin. I should take note of the distinctive odor of the skin, and I should inspect the generalized skin color, the variations such as the brownness, the yellow, the yellowness, redness, the pallor, cyanosis, the jaundice, erythema, and vitiligo. And I should also inspect the skin breakdown if there's any, the presence of pressure ulcer, and I must use the staging criteria. So, ma'am. Okay, let's see. Book na tayo. So the next thing that I will do is to palpate for edema if it is present in my client by pressing my thumbs over feet or the ankles of my patient. Okay, ma'am? Check po natin kung may tingnan po ulit tayo. Yan. Check po natin kung may po tayo. Check po natin. Here. Next is I should inspect for primary or secondary or vascular issues. I should also note the type, the size, the shape and the location and the distribution, the color and the configuration of the seat lesions. Okay, so ma'am, kanina may napansin po ako na maliit na sugat sa bandang kanan niyo po. So, ito po, ayun, no? Let's take the, nanote po natin yan. So, ayan lang po yun. Yes. Ayan. Ayan yung pasa po kanina. Ma'am, kanina as I inspect your back, may mga nakita po akong lesions din. And I should take note that as primary shot. At ma'am, wala naman po tayong, breakdown dito sa ating tummy area.
Wala po.
Thank you po for confirming. Rotation. Na-expect po natin na-expect po ulit yung simulation natin sa kanina. Okay po, ma'am. Thank you po. Next is to palpate for the skin lesions. I should apply gloves if there's lesions or if the lesions are open or draining. Ma'am, sorry po yung mga sugat po ba natin? Check po natin kung yung sugat natin. Pagka pinalpate po ba natin or kinapa, medyo pag kinapa po ba natin masakit? Yung likod po natin. Ulit. Ma'am, pagka may napako pa ba dito, masakit?
Hindi po.
Hindi. Yan nakangate. Lang. Malawak lang. Hindi po. Ma'am, natin. There we go. Like so, and I should palpate the texture, the roughness, and the smoothness of the skin by using the palmar side or the palmar surface of my 3 middle fingers. So, since we're going to palpate for the roughness and the smoothness of the skin of the patient, I should therefore remove a glove. Like so. Okay po ma'am, magpapalpate po tayo ng yung roughness and yung ating kanina naman po napansin ko sa back as I palpate. temperature. Is it cold? Is it cool, warm, or hot? And of course, I should also assess the moisture of the skin. Is it dry, sweaty, or oily? Using the dorsal part or dorsal side of my hand. And I should compare the 2 feet and 2 hands using the back of my fingers. The dorsal part of the fingers. So, mag-check po tayo ng ating, kung mainit po yung skin natin. Okay. Normal naman po yung warm naman po yung skin natin sa touch, and so far normal din po yung moisture ng ating skin. And I should also take note of the skin turgor, or the fullness or elasticity of the skin by lifting and pinching the skin of an extremity. So, iti-check po natin yung elasticity ng skin natin. So far po yung elasticity ng ating skin ay So, the next assessment will be the assessment of the scalp and the hair. First thing to do is I should inspect the color of the scalp and the hair. Ma'am, upo tayo. Sa ulo na po mag-inspect na. Like so, and the next thing to do is I should inspect the evenness of the growth of the hair over the scalp, the amount of the distribution. Evenness yung and I should also inspect and palpate for the thickness and the thinness, texture, and the oiliness of the scalp and the hair. And I should also take note of the presence of the infections and infestations by parting the hair of my client in several areas and checking behind the ears along the hairlines at the neck. Okay po? Like so. So the next assessment will be the assessing of the nails. So first thing to do is I should inspect the grooming and the cleanliness of my client. Next is I should inspect the fingernails, the fingernail pale shape, the fingernail pale shape to determine its curvature and the angle of the nail. So, sige ma'am, check po. After that, I should palpate the texture and consistency of the nails. Okay, ma'am, check po. And I should inspect the tissues surrounding the nails, its colors, and the markings. And after that, I should test for capillary refill. Okay, I should test for capillary refill by pressing 2 or more nails between my thumb and my index finger. And I should look for blanching and the return of the color to the nail bed. So, po. Check po natin. Okay, so after testing for capillary refill and checking the tissues around the nail bed, I should now draw the location of the skin lesions on the nails, the front and back. So the next assessment will be the assessment of the head. Okay, so the first thing to do is to again interrogate my client or ask the client some questions regarding the head. So, ma'am. So the first thing to do is I should assemble the equipment, which is the small cup of water, the stethoscope, the pen light, and the mask and the clean gloves. First thing to do after assembling the equipment is I should palpate the skull or the head of my client for size, the shape, and the symmetry. After assessing for symmetry, shape, and size, I should now palpate for possible nodules or masses and depressions. And I should also note for deformities and lumps and tenderness. So, notice that there are no nodules. And there is no tenderness nor pain that the client experience. So only depression and occipital area. Okay. Next thing to do is to palpate each side of the head using gentle rotating motion with the fingertips. And I should begin at the front and assess down the midline. So like so. And after that, I should also inspect for the facial features such as the symmetry of the structures, the facial expressions, the involuntary movements, and the skin color. After that is I should take note of the symmetry of the facial movements. I should ask the client to elevate the eyebrows, close the eyes tightly, then puff the cheeks, and smile. Then show the teeth. After that is I should palpate for the temporal artery for tenderness and elasticity, and I should do it once at a time in a very quick manner. After that, I should palpate for the temporomandibular joint excuse me, for the range of motion, the swelling, and the tenderness, or the crepation by placing my index finger over the front of each and I should ask the client to open her mouth, and if the client has infrequent headaches. After that, I should document the findings of the client. I should document the findings in the client's record, and by using the forms or the checklist supplementary by narrative notes when appropriate. Next assessment, which is the eyes and vision assessment. And again, the first thing to do is to interrogate the client about the history or the current symptoms of the eyes. So, first thing to do is to assemble the necessary equipment like the face mask, the gloves, and the Snellen chart right here. Snellen chart and the cotton tip applicators, the centimeter ruler, and pen line. After that is I should now inspect the eyebrows for the hair distribution and the alignment of quality and alignment and the skin quality and the movements of the eyebrow. So the next thing to do is to inspect the eyelashes for evenness of distribution and the direction of the curl. So the next thing that we're going to do is to inspect the eyelids for surface characteristics, the skin, the quality and the texture, and the position in relation to the cornea, the ability to blink and the frequency of the blinking. I should also inspect the lower eyelids with the while the eyes are closed. I should then inspect the bulb or conjunctiva. It is lying over the sclera for color, the texture, and the presence of lesions if there's any. And then I should also inspect the palpebral conjunctiva for the color, the texture, and the foreign body. And for foreign body. After that, I should inspect and also palpate the lacrimal glands. I should also, by using the tip of my fingers, palpate the lacrimal gland right here and observe for I should also observe for edema between the lower lid and the nose. Like so. So the next part is I should inspect and palpate for the lacrimal sac and the nasolacrimal duct, and I should observe the evidence of increased tearing by using the tip of my index fingers, and I should palpate inside the orbital rim near the inner canthus. The next thing to do is I should inspect the cornea for clarity and texture. I should ask the client to look straight ahead. I should hold the pen light at an opaque angle to the eye and move the light across the cornea surface. After that, I should perform the corneal sensitivity or the reflex. This is a test to determine the function of the fifth cranial nerve. I should ask the client to keep both eyes open and look straight ahead. And I should be careful, and I should approach from behind, beside the client, and lightly touch the cornea with the corner of the gauze. So, you ready, ma'am? So, look straight lang po. Check natin yung cornea reflex natin. Look straight lang po. Look straight. Okay. So, keep wide open. Eyes. Natin. Okay. So, yeah. That's it. Good reflex. After that, I should inspect for the pupils, for the color and the shape and symmetry and the size. I should see the variations in the diameter. So, the next thing will be, I should assess each pupil, the direct and indirect consensual reaction to light. That is to determine the function of the third CN, the third cranial nerve, which is the oculomotor, and the fourth CN, which is the trochlear. So for the next thing will be, I should assess the pupil reaction to accommodation. Then the procedures will be, I should hold the pen light. Okay, I should hold an object rather. the pen light or a pencil, maybe about 10 centimeters or 4 inches away or from the bridge of the nose of my client. I should then ask my client to look first at the top of the object and then a distant object, for instance like a far wall or far object behind the pen light. And I should alternate the gaze from the near to the far objects. Then I should also observe the pupil response. Pupils should constrict when looking at a near object and dilate when looking at a far object. Then I should ask the client to look at a near object. Then I should move the pen light or the pencil, either of the two, pencil or the pen light, towards the client's nose. Okay. Okay po. Next assessment will be the peripheral visual fields.
That's why I don't worry about the things that I don't see. Yeah. These days I don't worry about much.
So the next assessment will be the extraocular movements. This is to assess the 6 ocular movements to determine the coordination and the eye alignment of the patient. So,
That too far away from my words.
next visual test will be the assessing of the eye reflex by shining pen light on the corneal and covering the one eye basically. So, pakita ko kayo sa mata and try po natin sabihin sa akin. After all those assessments, I need to document all the findings and will now proceed to the next assessment, which is the ear and nose assessment. As usual, the first thing to do is to interrogate our client regarding the ear and nose. After assembling all of the equipments, I then need to inspect the auricles for color, symmetry, and the size and position. Right after that is full palpation of the auricle for the texture and the elasticity and the areas of tenderness. And for the third part is to inspect the external ear canal for the following: the cerumen, pus, the skin lesions, and the blood. Okay, ma'am? Like so. The next assessment will be the inspecting of the tympanic membrane for color and the gloss, which I already did. And the next one will be the gross hearing acuity test. Okay, ma'am? Okay, so the next po na assessment natin will be the watch tick test. Like so. The next assessment will be the Weber test and the Ryan test. So let's first get the Weber test. Hold the base of the tuning fork and place it on the head for the Weber. Now for the Ryan test po, ma'am. Now after all those assessments and tests, I then need to document all of the findings. So for the last assessment, it would be the neck and lymph node assessment. So again, we need to gather the materials, and after that, we then need to ask, as usual, the client for some questions. After that is I should inspect the movement of the thyroid and the coracoid cartilage of the thyroid gland, and by having my client swallow a small sip of water. Okay po ba? Bago po muna yan. Assess po natin yung ano? Ito tayo? Extend po natin yung good tayo. Okay na yan. Spend more laps. Wait lang, wait lang. No. Okay. Then, thank you, ma'am. After that is I should inspect the cervical vertebrae by having the client flex the neck, which we already did. And I should then inspect the neck range of motion by having the client turn to the right and the left shoulder to touch each ear to the shoulder like so, to touch the chin to the chest and lift the chin to the ceiling. Okay po, ma'am? Kaya niyo po bang ear niyo Okay po. Thank you po, ma'am. Yung shoulders natin. Ayan, no? Okay, after that is I should palpate for the trachea by placing my fingers on the sternal notch, feeling to each side of palpating of the tracheal rings. Ma'am, papalagay ko lang dito banda, no? After that is I should then palpate for the thyroid gland. Okay, ma'am? Pero tingnan lang po tayo ng konti. Like so. So after that is I need to auscultate for the thyroid gland for Bruce sound if the gland is enlarged. And for that, I'm going to use the belt side of my stethoscope. Okay, ma'am. Can we extend our neck lang po? Hinga lang po tayo ng ha? Hinga lang po tayo ng naman, okay? Next up, thing that I will do for the leg and lymph node assessment is to palpate for the lymphatic nodes. Magpapagay po tayo mga bawal ko dito banda. Like so. After all of this assessment, I need to place the patient back to a comfortable position. And I should take my client. Ma'am, thank you for cooperating po. And I should place the call bell near the bed or ask if my client needs any more assistance and clarifications. Like so. Ma'am, thank you po for attending and cooperating po for today's assessment. And may mga gusto po ba kayong katanungan or clarifications, needs, and wants? Okay, if you need me, ma'am, I'll just be around po. I'll just click the call bell. And after that, I need to gather all of my equipments and dispose of all disposables. So I need to remove my gloves and retain the mask. So, and perform hand hygiene or hand rub rather. Yeah. assessments are done immediately, and I should take note of the time and the assessment of the test and such, and all of the notes that is needed to be taken, the dizziness and the consciousness, the alert level, and the state of my client. So that will be all. Thank you.